Now here you can just suppose this is the pelvic cavity. We just forget about that. This is the phantom wall and this is the table over here. We just have in our mind that we are at clinics and this is the live animal, and this table is now a pelvic cavity. This is the reproductive system of the cow or the buffalo. Okay, and I'm just standing behind the animal. The face of the cow or the buffalo is in the direction of my face. So the right hand side of the reproductive system is as my right hand side. Okay, so we can just identify that this is the right ovary or left ovary. How? Because me and the animal are in the same direction. Okay, so how we are going to mimic like that in the live animal? So we are just having in our mind that this is the cervix over here, because we are just having these tracks from the slaughterhouse, and vagina and vulva usually is missing over here. But in the live animal, before cervix there is vagina and then vulva. That is the entry, you can say, toward the reproductive system, the outermost part of the reproductive system, the external genitalia. I'm just supposing over here that this is the vulva and then this part is the vagina and then there is cervix. Okay, so we are going to examine by the transrectal examination. Okay, so I'm not going to insert my hand from the vulva, I'm going to insert my hand from the anal sphincter. Okay, from the anal sphincter, that is the opening for the defecation. Okay, for excretory system. Okay, so you are going to examine the animal via the rectal wall, and rectal wall is having the elasticity. Okay, so that's why you are going to examine the ovary or the cervix between your hand and the reproductive tract. You must keep in your mind there must be the rectal wall when you are going to examine the live animal. So I'm just going to suppose similar as in the live animal over here. The only difference is that in the live animal it will be attached and will be suspended in the pelvic cavity, and there must be some forces from the live animal. Okay, so now I'm just going to start. What should be the normal, we can say, procedure to start blind palpation? I'm just going to make my hand as a cone shape. Assuming that I'm standing behind the cow and this is the anal sphincter, I'm going to insert my hand in a cone shape. Okay, in a rotating pattern, so that you can easily expand the anal muscle or the anal sphincter. Then as you just pass the anal sphincter by your examination hand, now you can feel that your examination hand is in the rectum of the cow or the buffalo. And just like here, I'm just going to move my hand in this pattern by expanding my hand to expand the rectal wall and making more closer toward the pelvic floor. So we have the information that the reproductive tract is in the pelvic cavity. Okay, plus within the pelvic cavity, the cervix you can find on the pelvic floor, and on the pelvic floor it will be on the midline of the pelvic cavity, and midline is found by the right and left pubic bone of the pelvic cavity, that is also known as pubic symphysis. Okay, or oscoccy is a complete bone. Okay, pubic symphysis or symphysis pubic. Okay, so this is the midline of the pelvic floor, and you can feel the cervix over here. Again, I'm just making cone shape my hand, rotating it in this pattern, and now I'm going to expand my hand in the rectum. The rectal wall is moving with my hand, and I'm going to more closer toward the cervix. Now here I will just make a picture in my mind that I have practiced over here for since longer, your previous semesters on the table. You have the information cervix anatomically, how it look like. It is somewhat, you can say, chicken neck like, cylindrical, elongated structure, or rope like. Sometimes in a slang word we used to say that, and it is having some kind of the rings. It has a specific texture that is different from the entirely muscular part of the reproductive system. So you can easily hold, yeah, this is the cervix. Okay, and now just look at my hand, how I'm going to fix the cervix or examine the cervix along with the blind palpation. I'm going to fix the cervix of the cow or the buffalo between my index finger and middle finger in such a way that the thumb is free to examine the external os of the cervix. Okay, now you can look over here, the external os of this animal is tightly closed. If the tip of my thumb is going to insert inside the external os more than 1 centimeter or 2 centimeter, it means that external os is open. But right here, this is tightly closed. Okay, now along with the palpation, I have examined the external os. Okay, and then I'm just going to check the biometry, the diameter of the cervix. You have practiced in your previous classes. Okay, the diameter of cervix, you can look like that. Right now the diameter of cervix of this animal is almost 1.5 or 2 centimeter. And then the length of the cervix. Anytime I'm going to perform the another procedure, I'm not you can say breaking my contact with the cervix. I'm not, you can say, making the cervix to get free from my grip. So anytime it is just in my hand. just I'm making the different movements of the fingers. Okay, so now the length of the cervix by the help of the index finger. First of all, I'm just trying to locate that where is the, you can say, the part of the cervix that is the internal os. So this is the point to measure the length of the cervix. Okay, I'm placing tip of my index finger over here and now measuring the length of the cervix. It is almost 4 or 5 centimeter. Okay, because the length of my index finger is 7 centimeter and each digit of my index finger is almost equal to 2.2 centimeter. So it's almost 4 centimeter right now. Okay, so this all you can say you have done with the examination of the cervix. You have examined the length, diameter, external os, and again you can palpate the cervix to check the normal texture. Is that the normal texture or is there any abnormal change in the texture of the cervix? And then I'm just going to perform another thing, that is the retraction of the reproductive tract. What is retraction? You will hold the cervix, you will fix the cervix between your hand and you are going to, you can say, just pulling back the reproductive tract towards your side. That is called retraction of the reproductive tract. What is the significance of retraction? One, it is making easy for the clinician to move toward the next part of the reproductive system. And what is the next part? That is the intercardial ligament, to examine the rest of the reproductive system. Okay, so that is the intercardial ligament. And other, if the retraction is difficult, it means that something is inside the uterus that is putting some weight. That may be the pregnancy or maybe some other abnormality that is making some weight inside the uterus. It will make difficult retraction of the reproductive system. Okay, so by the retraction of the reproductive system, I'm just going to hold the intercardial ligament, and once I have holded the intercardial ligament, now I'm going to examine the diameter of the horn, every horn, the right or left, we have to examine both horn. Okay, so now the left side of my hand is equal to the left side of the uterine horn. Okay, this one is the left uterine horn of that particular animal, and you can look over here how I'm going to examine the diameter. I'm just pinching the uterine horn from the attached surface and I'm just making you can say more possible to touch that how much the area of my index finger it is covering over here. Okay, so almost this is right now 3 centimeter. And similarly you can measure the diameter of the other horn. For the other horn, you know that how I am moving my thumb toward the other side, now fixing that horn and again making free my index finger with the help of thumb and index finger. Again I'm going to check the diameter. Here I can easily say that the diameter of the right horn is somewhat less than the left horn. You can check over here. This is almost 2 centimeter. And then you can examine the ovaries from here. From here you are going to perform another technique, that is the rolling of the uterus. Rolling of the uterus, just like that, we are holding the intercardial ligament and you are rolling your hand along with the uterine horn. This is the rolling of the uterus. What is the significance of this technique? One, it is making more easy to approach the ovaries or rest of the uterine horns to examine. And the other thing, if again there is something inside the uterine horns and it is making some kind of the weight, the rolling of the uterus will be difficult. If the rolling is difficult, you will have a picture in your mind, there must be something inside the uterus that is making some weight inside. Okay, so this is the rolling of the uterus. Now I'm just going to decide which of the ovary I can palpate first, the right or the left. We have to examine both. Okay, so I'm just going to examine the left ovary first in this animal. I just moving the uterus in this pattern, that is the rolling of the uterus, and I'm making my thumb to somewhat free to locate that where is the ovary right now. Okay, so I'm just making the ovary to get closer. Until unless I'm not sure about the ovary, until unless I'm not holding or fixing the ovary completely, I'm not going to release the intercardial ligament or the particular horn of that side. Here you can look over here, the ovary are just near to me, and now I'm just releasing the other horn that was the opposite side and fixing the ipsilateral horn to the ovary, and now I'm just going to hold the ovary in this pattern between my index finger and middle finger from the attached border of the ovary. And now I'm just going to check the biometry of the ovary, that is the length of the ovary from the anterior pole to the posterior by the help of the index finger. It is almost, you can say, 2 centimeter, right, 2 centimeter. And then the thickness of the ovary you can measure from the one surface to the other, from the lateral surface to the medial. Okay, and you can just pinch the ovary between your index finger and thumb. Along with that, I'm not leaving the ovary, not releasing the ovary. My middle finger is on the same position. Okay, so now you can say that the thickness of this ovary is almost half centimeter. Okay, and the other thing that we are concerned about the ovary, we are going to palpate, is there any structure on the ovary? Okay, from anterior pole to the posterior pole, if there is any palpable structure, we will identify that. Okay, and then we are concerned about if you are having some difficulty to hold the ovary in the live animal, and you are feeling that somewhat is change in the shape of the ovary and texture of the ovary is not very clear, and you have a picture in your mind, maybe something is covering the ovary, that might be the ovarian bursa. So we are going to check the overo-bursal adhesion if it is partial or complete. The method is that we are going to hold the ovary between your index finger and thumb in this way. If the ovary is of larger size, you can take help of your index finger and middle finger on the uterine end, or you can say medial surface of the ovary, and on the opposite surface you are pressing the ovary by the thumb. Okay, and the other finger that are free you are going to insert along with the uterine end of the ovary, or we say that usually the medial surface of the ovary. The ovarian bursa is toward the uterine end. Okay, so you are just moving your fingers in this pattern, sliding over the medial surface and making some movement of the fingers as a fan like pattern, and here you can feel that the ovarian bursa is free. If it is attached, you can have a picture just when you are going to hold the ovary, but we have to confirm either it is partial or confirmed. That's why you have to you can say memorize this method to check the overo-bursal adhesion. Okay, so this you all have done with the left ovary. Now you have to examine the other ovary, how you can reach the other ovary. Just like that, you are traveling toward the left ovary. Now we are just going to reverse back. I'm going to check the other horn, other ovary. The direction is that similar ovary. I'm just going to move along with the broad ligament, and if this is the left ovary and this one is the ipsilateral horn, this is the left horn, and again now we are just holding the reproductive tract from the intercarnal ligament, and now I can go for the other ovary. I'm just again moving with the uterus. This is the rolling of the uterus. In this way the ovary is more easy to approach, and now I'm taking the help of my fingers, not the thumb. For this side the thumb was free to locate the ovary. Now this side I can use the other fingers to check where is the ovary. You can easily feel that this is the ovary, and now I just holded the ovary and the uterine horn together in my hand, and now releasing the uterine horn when I have fixed the ovaries. Okay, and now again you can repeat all the procedure, the length, the thickness, okay, and any palpable structure on the ovary, and then the overo-bursal adhesion. And you know that we just have performed the diameter of the uterine horns, and now we can go for the length of the uterine horns. Okay, you can take the length, you can say first before examining the ovaries, but to me when you are going to practice frequently, this is more easy when you are going to examine the intercarnal ligament. At the same time you can check the diameter and the ovaries. Now you have to check the length of the uterine horns. How you can check is the right or the left horn. The length of the uterine horn, you can just holding the uterine horn, and this way the index finger should be free to check the length. This is 7 centimeter, and you have to check the remaining part. I'm just sliding my thumb along with the way of the uterine horn, and now the index finger again is free. So this is almost 14 centimeter, and here you can add 5 or 7 centimeter more. You can say that this is 18 centimeter or 20 centimeter, keeping in mind the internal factor of the uterine horns, the internal bifurcation of the uterine horns. So here you can say more margin of error. You just measured 14 centimeter. If you are saying that it is 16, 18 or 20, it's okay. Why? Because we just have measured from the false bifurcation. You can add some value. You can specify that these centimeters are from the internal bifurcation. Okay. Here you just have to, when you are going to palpate the uterine horns along with the length, you can look at my hand. I'm trying to check that where are the anterior pole of the uterine horns. This is very important. Again, to examine that in your previous class, you know the significance of the identification of the anterior pole of the uterine horns. If the animal is recently, you can say, calved within the postpartum period, after 15 or 20 days, we have a reproductive check in the commercial farms. If the anterior poles are easily approachable, it means that the uterine involution is moving on with the normal speed. Okay, if it is even after 20 days of parturition difficult to approach, it means that there is something wrong, and that is leading toward the delayed uterine involution, and ultimately it will increase the postpartum period. It can make the delay in the you can say estrus after parturition. Okay, so you have to identify the anterior poles. Here you can easily check, you know that this is the tapering end of the uterine horn, and theoretically what can be the next one, that is the uterotubular junction. And this is sometimes you can say occasionally you have to identify the uterotubular junction in a specific animal when you have to perform a specific practical or procedure or technique, that is the tube patency test to check that either the oviducts are blocked or open. We perform a test, that is the tube patency test. There are many tests. One of them that can be performed by the, you can say, just locating the uterotubular junction, and by the help of another instrument, that is the Foley catheter, you can infuse a particular chemical or liquid or a stain inside the uterus up to the level of uterotubular junction. If the fluid is freely moving from the oviduct, it will go toward the peritoneum. It means that the oviduct is not blocked. From the peritoneum, that particular stain that we inshallah will discuss in our coming semesters. So right here, just to have, you can have in your mind that is somewhat of PSP dye that we use in a particular practical. Okay. So if the peculiarity of that particular stain is that from the peritoneum it will be absorbed and it will excreted in the urine, and it will give a specific color to the urine after 30, 60 or 90 minutes of the procedure. And that can have we can have a picture that the oviduct of that particular side is open or closed. Okay, so that's why sometimes we have to identify the uterotubular junction in a specific case. Otherwise, this is, you can say, enough to just identify, palpate the uterine horns, the length or diameter, and then to identify the anterior poles. Okay, so that was all about the blind palpation. Along with the blind palpation procedure, we have performed the examination of different you can say structures of the reproductive system by looking for some you can say contents in the uterine horns by palpating the uterine horns, by looking for some structure on the ovary by palpating the ovary, to check the change in the text of the cervix by palpating the cervix, and then along with that we have measured the size, the length or the diameter or particulars of any structure, to check that either this is within the normal range or is there any change. If this change is physiological or pathological, that we will practice in the coming semester. Okay, that was all about blind palpation. Now, any questions?